Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, a new report from the Auditor General of the state suggests major changes in the way that Pennsylvania State University, otherwise known as Penn State, operates, and then the state has to make big decisions about Medicaid expansion, the health insurance exchanges. We'll be back with all of that and more after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back. Well, we have two of the state's leading journalists, Brad Bumsted from the Pittsburgh Tribune-Review and Robert Swift with Times-Shamrock newspapers here to sort out the Penn State matter. Brad, I want to start with you. I can never say this Pennsylvania State University. Does anybody ever call it that?
No.
It's right. It's just Penn State.
It's Penn State.
But this Pennsylvania State. Okay. All right. The Auditor General, Jack Wagner. He's going out of office at the end of this year. Weighed in with a pretty important report about structural changes that he thinks has to happen at Penn State to avoid some of the problems it has had. Go through a couple of them.
Sure. The culture of silence that exists at Penn State, according to the Attorney General, all related to the Jerry Sandusky conviction. Auditor General Jack Wagner is saying that's going to continue unless you make some changes that remove the awesome power of the president of that university, who also sits on the board and is the board secretary and basically controls everything. He's saying that has to be scaled back. He's saying that other public universities that he looked at don't, for the most part, do not have that. Large universities don't have it. He also said that the governor of Pennsylvania should not be a member of the Board of Trustees, that that's a conflict of interest. And he used really strong language to say that he thinks the governor and the legislature need to step up and make sure that these changes get done.
Look, you're the historian among the State Journal. I'm not suggesting that Brad and these other folks don't. Brad has a book coming out. We got to talk about that at some point. Historically, why did governors serve? I
was struck by Wagner referring to that these basic laws date to 1855, when Penn State was formed as one of the first land-grant colleges in the United States. Put it in the middle of the state, but was a central part, but in the middle of nowhere. But a lot of the governors were from Bellefonte at that time. Governor Curtin, Governor Packer, you had that going on. And you look at over the years
now,
to Penn State.
For the geographically impaired, I'm one of those. Yeah. Bellefonte, right next to State College, right?
That's right, okay. The county seat.
Right, county.
Of Center County. Then also, I mean, over the years, you've had people like Milton Eisenhower, the brother of President Eisenhower, holding those awesome powers that Wagner's talking about.
Yeah.
You've had, really prominent people, but he's saying there's too much power in one person.
Yeah. I guess, Brad, the theory was, and you've studied state government for a long time, is that if you're Penn State, because you get money from a whole variety of sources, from alums, also from the state, you want powerful people on the board, don't you? Isn't that the whole point?
Yes, but Wagner talked about how members are selected for the board, and it's the agriculture community that votes for the agriculture members of the board. And there's no other, he says there's no sort of public avenue for business types to get on there. Yeah. And the trustees, it's very closed, insular culture there. Now, Wagner was saying that he doesn't believe and he can't contend that if you made all these changes, it would have stopped the Sandusky,
right.
But he says it would certainly contribute to that type of behavior being curtailed. And he just made a really strong case that, look, a year after Jerry Sandusky's arrest, virtually nothing of substance has been done, including putting the university under the right to know law.
Yeah. Oh, well, the right to know law, go ahead. I know you have thoughts on that.
That, was something was supposed to have been done this session. Senator Pileggi was, pushing it. All of a sudden, nothing gets done. It gets pushed off into next year.
Now, hold on, just so by the right to know law, explain what that means to our
That's where, that's the law that was enacted in 2009 that expanded public access to government documents. Penn State was exempt, and the state-related were exempt from that law, and there's legislation that's been in there to bring them under it, so let the public can get greater access.
Now, hold on. If you guys want to go, and presumably the public want documents relating to sort of the activities at the university, we're not talking about personnel. There are exemptions, right?
Yes, sir.
There are exemptions. Then there's a process to go through to get that information. Is that right?
That's right. And pushback against this came primarily from Penn State, Wagner says, and he says that particularly that Graham Spanier, the former president, just blocked this basically.
Well, let me pursue that. Have you used the right to know law?
Yes, I have. It can be, especially with the legislative records, but it can be frustrating process. If they don't have the actual record at that moment, they'll deny it.
Or if you don't say it right.
Yeah, if you don't say it right.
You don't name it right.
So in other words, you use it because in your reporting you want information for your stories, or you...
Right. Yeah. I mean, local governments, though, they claim there's too many frivolous requests, and they want relief from that. So
there has to be some balance. I think as reporters you would agree. You can't have people asking for 9,000 documents, right? But
not unless they're going to pay for them.
Not unless they're going to pay for them. All right, here we are. We're at the end of a session of the legislature. A new one is going to get started in, about 6-7 weeks or so, and already we're looking at the agenda for next year. We never let anything just go away. But we'll be back. We're not going away.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're talking with Brad Bumsted and Robert Swift, two of the state's leading journalists. We just sort of reviewed the Penn State situation. Jack Wagner, the Auditor General, came out with a new report, sort of one of the remaining reports or audits, I guess we'll hear from the Auditor General. I started with Brad. I'll start with Robert. All right, Robert, here we go again, as they say. Sell the liquor stores, school choice, pensions. I mean, the agenda's huge. But the legislature, except for the Senate, looks pretty much like it did, right? The same leadership. Go ahead.
Republican control, legislature, same leadership teams, pretty much. It was interesting on the last day of the session this week, Senator Scarnati, he sort of said that transportation funding has to get done. He's pretty emphatic about that. They do. When they come back, they're going to be New Year's Day, because the first Tuesday
so that means they're not going to go out and celebrate New Year's Eve?
They'll be here in town, maybe.
That means you have to be there and cover. You can't celebrate New Year's Eve. You're going to be on the job. Go ahead.
That's right. We'll be there watching them get sworn in. And but in Senator Scarnati the Senate, where he is the leader of, 27-23, narrower margins, more difficult for maybe some of Governor Corbett's second half of his first term priorities.
One of the things that Governor Corbett is no fee, no tax hike position, but on the business of infrastructure, roads, bridges, mass transit, we've done a lot of programming on this. It's going to take fees, license fees, registration, or oil franchise tax, right? I mean, is there any way to do this without raising quote, fees or taxes, do you think?
Well, of course not. There have to be. I mean, it's $2 billion minimum that they need. And Governor Corbett, in an interview with me months ago, did raise the idea that the changing the oil franchise tax rate, which can go up or down, is a free market issue, and that he might consider that or take a look at it.
So it'd be a technical adjustment because the current rate is something like $1.85 a gallon or close to that, and we're now paying what? You pick the figure, $3.54 a gallon. Is that your point?
It is.
So that would be a technical adjustment.
Right. But the other revenue with driver's license fees and all of that presumably is going to be part of it. Look, in January, it's the furthest point from the next election for state house members, if they're at all fearful of raising all this revenue. And it's really the best shot to deal with transportation early in the session. But Kevin Harley, the governor's spokesman, has said that the change of the liquor board and privatizing it is on the governor's agenda, and it's something that he's going to push. We'll have to hear from him shortly.
Sell the liquor stores.
Yeah.
Robert, you've been through that for how many years?
I've gone through it 3 times, and different, Governor Ridge was going to use some of the money for I think stadium improvements for sports stadiums. This time around, it's going to be a big question, where would the revenue go? What would it be used for from the sale of the stores?
Isn't there a big question about how much revenue it would actually raise? I mean, during the course of the debate about after the initial licenses, right?
That's sort of a red herring, though, because we always talk about this $400 million or so that comes in from the LCB,
right.
But about $250 to $300 million of that is taxes that will still come in.
Right.
So it's not that huge loss that people talk about. But here's the link, I think, is that we need transportation funding desperately. Liquor stores would raise a substantial amount of money up front. If Corbett can effectively tie those two together, he might have a winner.
There's already a bill to do that.
Yeah.
Is that right?
Yeah,
yes.
There is a bill to do that.
Jerry Knowles this session sponsored that bill.
Okay.
But it's been low level.
Yeah.
So you think, I mean, do you agree with Brad that's a possibility anyway?
Yes, I do. And the other thing you'll know is serious when the PennDOT secretary, once these lawmakers are going to vote for it, they have to know what's going to be done in my district, what bridge, what road.
Before I let you go, the other big issue has to do with pensions. And I've read different figures, $35, $40 billion for the two big pension systems. You know, they've got to have some funding to deal with it. The state is paying, what is it, like $1.7 million a year?
And it's going
billion
up
a year, and it's just going up and up. Is there, what do you hear, I'll start with you, Robert, and then we'll end with Brad. Any serious discussions about how to take care of that? Bond issue, maybe? I don't know.
I wouldn't say serious. The Public Employee Retirement Commission has been having hearings this fall on the thing. We'll hear a lot more about it when Budget Secretary Charles Zogby gives his mid-year budget briefing next month.
Next month. And, so you think we'll get some? You agree with that? You think we'll get some sense?
I do, and I think that you know what they're talking about is 401k type investments for new members.
But that's 15 years from now. It solves it. Doesn't help
and
now, does it?
It doesn't deal with the legacy costs that you have.
Okay. All right. Great update. Or when we come back, Carolyn Scanlan from the Hospital Association is going to be here. Boy, the legislature has to make a huge decision about Medicaid expansion. We're talking about 750,000 people that would be eligible. We're also talking about the insurance exchanges. We'll get into all of that. That's very important when Pennsylvania Newsmakers returns.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. As we talk about these health insurance exchanges, I'll get that out. Health insurance exchanges and Medicaid expansion are huge issues in the state. Carolyn Scanlan, one of the experts we call in from the Hospital and Health System Association of Pennsylvania, is going to help us sort this out. All right, let's talk about these insurance exchanges. It's like it's been described as like Travelocity. You can get on there and there's all these decisions that you're going to have to make when you get to be able to get your own health care. Right? You buy your own health care.
Healthcare insurance.
Insurance, some of which will be subsidized by the government for some people. Now go ahead. Take it from there.
All right.
Help us out.
The health insurance exchange is just that. It's a sort of a virtual electronic way of seeing what health insurance is available. Linked to that is the expansion of covering more people who are uninsured, which was part of the Affordable Care Act.
Right.
And so entering into the health insurance exchange to begin with will be people who are eligible for Medicaid, both existing individuals and those who will be newly eligible because of the potential expansion of the Medicaid program. And then there are a group between 100% and 400% of the poverty level who will be entitled to federal tax subsidies to help them buy their insurance. And it'll be a sort of a sliding schedule.
How many people do you say will be operating in this insurance exchange? Okay. I mean, real, sort of Pennsylvanians, the people out there in our viewers.
So in the state at the moment, we have 1.3 million people who are uninsured.
Wow.
So that, at a minimum, are the number of people who will enter into the health insurance exchange to buy insurance. Secondly, small businesses of less than 50 employees can also use the health insurance exchange to buy insurance with or on behalf of their employees. So this could be several million people right from the beginning. This is not a little
deal, is it?
This is not a little deal. This is a big deal, and it really is to help people navigate the health insurance market.
So you go on a website and there'll be all of these different, now somebody's going to have to, look, I'm not the smartest guy in the world. I'm not sure I could do this. I hope somebody's going to have to help people navigate, yes, right, and explain all of this.
There's actually a role called a navigator.
Oh, wow.
And so there's actually an education component, wow, somebody that would be like an ombudsman or a navigator to help somebody wend their way through this, to either buy for themselves or their family.
Right.
But all of this is predicated on the exchange being in place in January 2014.
All right, now let me get this straight. Here's what I understand. Some states have said, no, we're not doing it all. We're going to let the federal government do it, HHS, Health and Human Services, you do it. Some states have said, we'll do it and do it exclusively, meaning we'll run it. So you can have you can have one of those two systems. Do I have that right?
Or you can have a partnership.
A partnership, that's right.
So the state and the federal government can partner to run the exchange.
And I think that's what the governor of Florida has just indicated he might do, by the way. He has said, I want to talk to them and negotiate. So maybe that's where it's...
People are beginning to signal that. In the original legislation, original time schedule, states had to tell the federal government by tomorrow, November 16th, whether they were going to run a state-only exchange. And now, as of last Friday, they have an extension that they can give the blueprint of that by the middle of December.
Middle of December.
And if you want to be able to do a state-federal partnership, you have until the middle of February to tell the federal government that.
Now, let me get this straight. Here's the big decision. We do not yet know what Governor Corbett will do. Is that correct? So we're waiting on the governor to decide, and this decision he gets to make alone. He does it, unlike Medicaid expansion. We'll get into that.
No, he needs legislative authorization to establish a state exchange.
The legislature needs to agree, but they're home.
Exactly.
They're gone.
Exactly.
Until January. So, but he could signal his intention to the... Go ahead, explain that.
He could signal that he wants to do a state-only exchange. I think there's lots of pieces that need to be considered about... there are still a lot of rules and regulations that the state doesn't know that the federal government will require. There are still issues about long-term financial feasibility of running an exchange. And in this state, our governor has linked it to the Medicaid expansion decision.
All right, we're going to take a break. Boy, this is huge. It's going to involve millions of Pennsylvanians. We're going to be doing a lot of programming on it in the I was going to say next year. I might be saying years ahead, right, to try to figure this all out and help you all out. All right, Medicaid expansion. The governor and the legislature still have to make a decision about whether to go along with the expansion. They won't be penalized if they do not, according to what we understand in the Supreme Court decision. We're back to a court decision. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
We're talking with Carolyn Scanlan from the Hospital Association and Healthsystem Association and say, all right, Medicaid expansion, it's allowed now. Governor Corbett, first of all, what does it mean when we say Medicaid expansion?
Well, we now have a public insurance program for people who are below certain levels of poverty and how much income they have. The Medicaid expansion allows for more people to be eligible for the Medicaid program. Medicaid program is a state-federal program. Right. Federal government currently, for people who are eligible for Medicaid and the costs associated with their health care, pays 55% of the costs.
State they're balanced.
And the state does 45%. In the expansion, which would also occur January 2014, they would pay 100% for 3 years for the new people to be enrolled in Medicaid and still continue at the roughly 55% for the old eligible individuals. And so for 3 years, the state gets 100%. And then starting in 2019, it starts to move down to 90%, but never drops below 90%, according to the Affordable Care Act. Clearly, the decision that the governor and the legislature needs to make is what would be the cost to the state of Pennsylvania in regard to this expansion, and are they, and I think they should be, somewhat concerned about the continuation of those high levels of payment from the federal government?
So that's the point. I mean, if the federal government were saying, and states could believe the federal government, not saying they would, they're deliberately telling, but who knows in the out years, the states could have to pick up more of the cost for the poor who are on Medicaid, basically.
Yes.
Is that it?
Yes. Now, for hospitals, why this expansion is so important is that there are funds that hospitals currently get through the Medicaid and Medicare program to help hospitals take care of people who are uninsured. That funding switches over to helping pay for the Medicaid expansion, and if the state, this state, chooses not to expand it, the hospitals still lose that money.
So, plus, I mean, you also have to take people who come in for their medical services and don't get reimbursed for it in many cases. Is that right?
So it would be a double hit. Not only would we lose the money and not get the expansion, but secondly, we would still be taking care of those individuals.
If I understand this, nationally, some states have said no already. About, is it 11 or 12, something in that range?
Have said no, but some of them are beginning to back off that a little bit.
As you mean the election might have had something to do with that?
Just a little bit of an impact. I think we are at a pivotal moment. I mean, Speaker Boehner this past week said, Affordable Care Act is the law of the land, and we're going to move forward. I think that's important for all of us to understand. And in the end, the most important thing to remember is that we have fellow Pennsylvanians who don't have health insurance.
Right.
Medicaid is a form of health insurance, publicly run, but still a health insurance for people who don't have it. And that's why the hospitals supported the Affordable Care Act.
All right, well, we're about out of time, but on this one point about maybe the maxim ought to be mend it, don't end it, right? If there are things wrong with it, fix it, but don't end it. As you're right, it's not going to be ended with the re-election of the president. Thanks for watching this edition of Pennsylvania Newsmakers, and as always, stay well.